After today, I don't want to hear anybody saying that they do not understand the difference between the normal vaginal discharge and the abnormal vaginal discharge. I don't want to hear it. Let today be the last day for that. Now, what is vaginal discharge? Vaginal discharge is that liquid substance produced by your cervix or your vagina, and it changes from time to time. The color and the texture changes from time to time within your menstrual cycle. So in this video, I'm going to tell you how to know when it is normal, abnormal, and what to look out for. By the way, if you just see this face, this is pharmacist Isn't Me. On this platform, I bring information about ladies' health to your doorstep. I help to educate my fellow ladies about our body and how to take care of it. Sometimes I also drop information on how to eat healthy. So if this is kind of content you like, please, my lady, do not forget to subscribe and tap on that like button. I am going to be starting with the abnormal types of vaginal discharge. The first on my list is if you're seeing something that is yellowish or greenish yellowish. These are signs that you have an infection. Infection, I mean an STI, a sexually transmitted infection. Yes, this infection can either be trichomoniasis, which many people don't know about. I'm sad because trichomoniasis is the most common case of STI. In fact, 163 million women get trichomoniasis infection every year. Yeah, you heard me. 163 million people, million women get trichomoniasis infection every year. You are familiar with other STIs like gonorrhea, chlamydia can make your vaginal discharge to be greenish, cloudy, and even have a foul smell. Other signs you can notice that can tell you that, okay, this is an infection or this is probably an infection is that you can notice soreness around the lips of the vagina, around the vulva, and you can also experience itching or painful urination. Whenever you see all these symptoms together, the greenish coloration and all these other things, just know that, my babe, you need to rush to the hospital and see your doctor immediately. Do not joke with this. It is also true that trichomoniasis is the most widely spread sexual transmitted infection. But why many people don't get to find out on time is that most times you don't notice any symptoms, you don't see any symptoms. And of course, when you don't see symptoms, you might not know that you are transmitting this infection and you keep on having unprotected sex and transmitting this infection from one person to the other. The second kind of discharge I would like to talk about, if you're noticing pink or reddish discharge, this could be a sign that there is bleeding in that area. This bloody discharge that looks reddish can be caused by a lot of things. But number one on my list is pregnancy. Yes. Surprisingly, it is medically called spotting. If you notice spotting, especially around that time that you are expecting your period, and you recently had an unprotected intercourse, there is a very high chance that, my babe, it is pregnancy, because there's something called implantation bleeding, which is an early sign of pregnancy. So, and it usually comes around that time you are expecting your period. So, if you're expecting your period and you just recently had unprotected intercourse and you notice any kind of spotting or bloody discharge, this is a sign that, congratulations, you have your baby. The second reason why you can have bloody or pinkish discharge or spot bleeding in between periods can be signs of serious health conditions. You've had your period earlier and your period is supposed to come in the next 2 weeks, and you're noticing it today. Bleeding in between periods, as the name implies, could be signs of a serious health condition. Health conditions like PCOS or even fibroids. Yes, it can also be a sign that you have PID, that is pelvic inflammatory disease. So anytime you notice spotting or bleeding in between period, please rush to the hospital and see your doctor for proper diagnosis and treatment. But as for the case of the greenish and yellowish discharge, this condition is usually treated with antibiotics. But of course, I don't expect you to self-medicate. Go and see your doctor so that a proper prescription written for you very treatable with the use of the proper sensitive antibiotics. For proper diagnosis, I would recommend you go for a lab test, high vaginal swab, that is HVS, and urine
Microscopy, culture, and sensitivity.
This is where they culture your vaginal discharge and check the exact
Microorganism.
that is causing this discharge, this greenish yellowish discharge, and give you the proper antibiotics that it is best suitable for it. Now, the third type of discharge, abnormal type of discharge I'm going to be talking about is the whitish or the gray discharge. Now, this is where the problem is because a lot of women feel that once they have a whitish or gray discharge, that means that they have yeast infection. Who told you that? My ladies, do you know that there's a normal type of whitish discharge? Yes, before I go back to this abnormal one, let's talk about the normal types of discharge. Now, for the normal type of discharge, a normal discharge can be clear, like clear, or it can be white. It can also be slippery. Now, if your discharge is clear and slippery, this is sign that you are probably ovulating. When it looks like that, the watery uncooked part of egg whites, this is sign that you might be ovulating. Secondly, also, if your discharge is whitish and smooth, whitish, smooth, and creamy,
More
just like what you're
vaginal
seeing here
discharge.
on the
Sometimes it can
screen,
be a little bit
this is a
more wet.
sign that you're probably entering into your fertile window, and this type of discharge is normal. I've seen most cases of women when they experience whitish discharge, they run to their hospital or to their pharmacist to get antibiotics. Well, I don't blame them because as you can see, it is actually similar. And if you're not well informed on the characteristic difference, you would mistake this kind of discharge for yeast infection. As for yeast infection, the discharge is usually whitish, yes. It is thick also, yes, just like normal one. But the significant difference is that for yeast infection, the discharge is clumpy. It is clumpy, just like cottage cheese. If you know cottage cheese, or like
As if it contains breadcrumbs. Like it's not smooth. Sometimes it might even be discolored. You would also
itching.
notice.
I mean, like severe itching down
That's
there
how
in
it
your
is.
vaginal area. Secondly, you're going to be having the discharge is going to have a foul smell,
Very
yeast smell,
whitish.
fishy smell. It's going to be
Disgusting.
smelling bad.
What is that?
But for the normal type of discharge, there is no smell. There is no bad smell. Also, you're going to feel soreness or tenderness or irritation around your vaginal area. So, with these few points of mine, I hope I have convinced you and not confused you about the difference between normal vaginal discharge, normal white discharge, and yeast discharge. Now, because I love you guys, I'm going to be teaching you how to check for your vaginal discharge. Now, there are two methods I'm going to be telling you about, two very important methods. Now, there's one we call the seeing method, just like the name implies, seeing what you see with your eyes. When you remove your underwear, you can check your panty liners, you can check your pants, your underwears, and check, look at it. Look at it for the color.
Perceive it for the smell.
Second method I'm going to be talking about is feeling method. Feeling, Feelin, feeling with your fingers. Now, this method is very critical. I will not advise you to do this method unless you are doing it correctly. Now, if you have artificial nails on, please do not practice the feeling method because it has higher chances of transmitting infection to your vaginal area. Yes, because these artificial nails harbor bacteria and germs within them. So I would advise, if you want to do the feeling method, that you want to insert your finger into your vaginal area to check how your discharge is, I advise you wear a glove, a sterile glove, do
Or
them with your natural fingers, and please wash your hand properly so that you don't transmit bacteria into that vaginal area. Don't go anywhere. I'll see you in my next episode of learning. Bye. Don't forget to subscribe.